Amy Reimer again. I'm going to be doing oral care on a conscious and unconscious patient and denture care. So first off, I'm going to get all my supplies outside of the room, and then I'm going to knock on the door. Knock, knock, knock. Hi, Jean. It's Amy, your nurse. I'm just going to go ahead and check your band here to make sure that it's Jane Doe. Date of birth, 6/4/38. Looks to be good. Jean, I hear you're going to get some company later on today, so we're just going to go ahead and do some oral cares on you. That's all right with you? Just making sure the bed's in the upright position so it's easier on my back. I'm going to wash my hands. Washing my hands. I'm going to get a wipe. Just getting my materials together, getting a clean work surface here for you, Jane. Make sure I have a clean work surface. Done with that. All right, I'm gonna wash my hands and get some gloves on. Go. Get my equipment on my table here. Perfect. Because she's unconscious, I'm going to make sure that my suction is hooked up. Machine is on and working. There we go. Stick a washcloth in my sink here. Stick one. I'm gonna go ahead and there we go. I'm just gonna roll you over to your side, Jean. There we go. Put my supplies right here. I'm going to put a pad down and a washcloth, dry washcloth, along with my basin. First off, I'm going to take my tongue depressor and my light, and I'm going to make sure that there's no sores in her mouth and she looks good. So I'm going to grab my toothbrush and my toothpaste, put some toothpaste on there. Using the tongue depressor, I'm going to make sure I'm getting all around, bottom, top, inside, and outside, making sure not to get any gag reflexes. Looks good. So I'm going to grab my syringe and my cup of water, fill it about 10 milliliters. And I'm going to go ahead and rinse out her mouth, making sure it all empties out and slowly into the Emerson basin. Looks good. I'm going to take my towelette, excuse me, and dry out the mouth. Good. If I needed to, I could use the bulb syringe to make sure that the rest of the water came out. Otherwise, if she was not doing well, I could suction her with this as well. Get rid of this. Dry up her mouth. Get rid of this. That her head is up. One last thing that I could do to help her out because she's an open mouth breather right now, I'm going to take some lubricant jelly and my cotton swab and apply some to her mouth. Now I want her in the upright position just in case there is extra water anywhere. All right, Jane, you're looking good. Make sure she has her call light just in case she needed anything. And that's that. Remove my gloves, clean my hands, put on new gloves, make sure that I cleaned up my area as well. Bringing everything over to the sink, rinsing it out, putting everything away, drying everything, making sure it's ready for the next person. Now if this was a conscious client, I would have her up just like this, making sure that her head would be up as far as it goes. And I would promote her to continue to do as much as she can for her ADLs, handing her things as much as she needs me to hand her things. Just putting a towel down to make sure she's not getting wet, hand her toothbrush, toothpaste, give her a cup of water to drink, rinse her mouth off, out, and then offer her some mouthwash before or after she's done there. And then she can spit it all out and again clean her up, but definitely promoting her to do her own ADLs as much as she could. Drying her mouth off, removing my gloves, washing my hands, putting on new gloves, getting rid of all my equipment, and that's conscious client. The next thing I'm going to show you is denture care. I'm going to pretend like this bucket here is my sink. I'm going to enter the client's room, knock, 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 wash my hands, put on some gloves. Hi, Jane. It's Amy. Introduce myself. Make sure that I'm doing the double check to make sure that that's her, and date of birth and name, and explain to her that I'm going to take care of her dentures. So what I would do was make sure that I start off with, I got the gloves on, I'm going to put a washcloth in the bottom of my sink just in case that it ever were to fall. I don't want to break the dentures. They're not cheap to repair. And then I would remove my dentures, rinsing them off in tepid water where it's not too hot, not too cold. I'm going to put toothpaste on my denture brush on the big side, making sure to brush all surfaces of the teeth, using the smaller portion for the grooves. Rinsing that out. And then if I were going to be putting this in overnight, I could ask her if she wants to put a tablet in there and I'd keep it in here. Otherwise, if I were going to put it into her mouth, I could offer her mouthwash before or after giving her the mouthwash, but I would always start with the upper dentures first and moving my way down to the bottom. If I'm putting the dentures in, I can also ask if she wants the paste to be applied. So again, making sure that all my materials are cleaned up, proper hand hygiene, remove my gloves, wash my hands, put on a new pair of gloves. Whenever I'm leaving my patient, I'm leaving her in the lowest position with her call light and asking her if she needs anything else. And if she says no, then Jane, you are not only clean, you have new linens, but you also have clean mouth and you're ready for some company. I'm going to discard all my stuff, clean up my mess, left her in the safe position, and I'm going to go document. And that's it. Thank you.